Pregnancy, Disability, and Women's Decisions, an 8-part series on pregnancy and pregnancy decisions. Part 2, Making Decisions About Pregnancy.
Ask yourself if you want to become pregnant in the next year. If the answer is yes, it's important to start preparing yourself for it physically and mentally. If you haven't already, start taking a multiple vitamin with at least 40 micrograms of folic acid, which will help protect the baby from spinal cord problems. Avoid any kind of secondhand smoke. Make an appointment with your healthcare provider and tell them it's for a preconception visit. They will know what that means. At that visit, you can discuss any prescription drugs you use that could pose a risk to the baby and any other health issues that might interfere with pregnancy, including any help you need stopping smoking, alcohol, or recreational drug use. Because problems with teeth and gums can lead to premature birth, it is best to be up to date with your dental care. And if you're being mistreated by anyone, including the person who might become the father of the baby, be sure to get the support you need to keep that person from causing problems with your pregnancy or any other aspect of your life.
I knew from the age of 7 that I wanted to have 3 children. I wanted 2 boys and 1 girl. However, here I am all of these years later with 3 boys. My first pregnancy was 50% planned. It was the year 1999, and my husband and I ran across a news story that promised abundant baby supplies for the first couple to have a child in the year 2000. My son came January 9th instead of January 1st, but that's okay. We loved him anyway. It was very difficult to raise a child while being in college at the same time, so we decided to wait to have more children until I finished and got my degree. We had our second son 5 years later. He was 100% planned as we were financially secure and ready to grow our family. My second son was 9 years old when we decided to try for another child. I really wanted a girl. However, I have another lovely boy. It was much easier raising the second 2 children as opposed to the first, as I had already completed college and was settled into my life.
Having a child that you've planned for can be a joyful experience, but for some women, becoming pregnant isn't in their plans, and they have some hard decisions to make.
I only knew the children's father for a short period of time before becoming pregnant, and I came from a mother who doesn't believe in abortion, so that was embedded in me. I just don't believe in abortion, so that's just how it was. I love children, and I don't believe in it.
Some women choose to keep and raise an unplanned pregnancy, but that is not the right decision for all women. Some women make different decisions. One woman talked about decisions around adoption and abortion.
It was all my decision. My family was saying that they wanted me to have the kid and give it up for adoption, but the doctor told them it was up to me. So the abortion is the decision that I made. If I had been pregnant with the kid, I wouldn't have been able to go through heart surgery. I would have been in more severe risk. I probably would have had to have been on bed rest the whole time. My heart was really bad before my heart surgery. I didn't have a job. My family wasn't going to be able to support it. I don't believe in adoption because I believe that every child should know who their biological parents are.
Another woman in a difficult situation decided on adoption instead.
When I found out I was pregnant, I was thinking about abortion. But then I thought it would be like me going out and shooting somebody in the head. So I told the director of Women's Services and a person from the adoption agency that I was pregnant. And we talked, and they told me that whatever I decided, they would support me. And I told them because of the dad being abusive, it wasn't a safe environment for my baby to be in. So they brought their computer over and looked up online, and there was an adoption agency nearby. We set up an appointment, and for 6 or 7 months I've been seeing a lady at the adoption agency. It's open adoption, with the sweetest people ever. They're very caring and loving people, and we get along really well.
These are hard decisions, but you need to make the choice that is right for you. Talk to people you trust, follow your own heart, and get the support you need to process your decision. If the answer to, would I like to become pregnant in the next year, is no, then it's important to think about how best to prevent pregnancy.
I decided that I didn't want to have a child very young. I was probably in my teens, and that's just because before then I didn't even think about it at all. I have a hard time taking care of myself and didn't want to spend anything I had left over on taking care of someone else. I wanted to spend it on my science and my art and my projects and on having a career. And I also just don't like children, and that's okay. My life, my choice. At first, I used the birth control pill to keep from getting pregnant. Later, my partner, who also didn't want to have children, and I decided to use sterilization.
Unlike Dora, many women are undecided about whether they want to become pregnant. If you aren't sure that you want to get pregnant in the next year, then you need to think about the best way for you to prevent getting pregnant for now. There are many ways to prevent pregnancy, including not having sex with men and various types of birth control.
Birth control has changed a lot and gotten a lot better since I first started needing it. Your experience doesn't have to be like your mom's. The birth control methods that work best are reversible implants and intrauterine devices and male and female sterilization. The implant and the intrauterine device, a lot of people call it an IUD, are reversible. They can be undone. They last for 3 to 5 years and can be taken out if you decide you want to have a baby or don't like the side effects. If you're with the same male partner long term and neither of you want to have a baby or want to have another baby, male sterilization or vasectomy can be a good choice. The other permanent choice is to have your own tubes tied, called a tubal ligation. The next best methods of birth control are the pill, the patch, a vaginal ring, or a birth control injection. You can choose the method that works best for you. Some, like the injection or the patch, you will have to take every few months or every month. Others, like the pill, you'll have to take every day. When you decide you want to become pregnant, these types are easy to stop using. You can pick what's easiest for you to remember and what you and your doctor, nurse, or other healthcare provider think will work best for you. No matter what kind of birth control you pick, in order for it to work, you will need to follow the instructions exactly. Male and female condoms by themselves are not good birth control methods. They are still better than nothing. However, male and female condoms are the only thing that can protect you from a sexually transmitted disease. It is important to use both a condom and birth control if you don't want to get pregnant and there is any chance at all that you might get a disease from having sex.
To get a copy of the CDC Family Planning Method Sheet showing all birth control options, go to the resource section of our website at www.pregnancyandisability.org/resources.
The Pregnancy and Support Services for Women with Developmental Disabilities Project is supported by National Institutes of Health grant number 1R21 HD 078830. The views expressed in these videos are those of the authors and do not necessarily represent the views of the NIH. The principal investigator was Mary Oshwald. Other team members included Andy Joyce, Annie Wallington, Christina Nicolaitis, Dora Raymaker, Alicia Askenazi, Kaki Marino, Marianne McCammon, Michelle Berlin, Phoenix Lomas, Sherry Osborne, and Sonia Sizemore. These videos are copyrighted to Portland State University, 2016.